Let's talk about my exam from yesterday.
If it hurts.
Wondering when you get home, baby. The clock ticks so slow.
So I took my exams from yesterday. Now me, I'm a type of person that I don't like saying if it's hard or if it's easy, because it all really depends on how much you studied, or if you studied correctly, or are you prepared correctly. Like that, like it's only difficult if you're not prepared. It's easy if you are prepared. But this exam threw me off. Like yo, legit, my G, it threw me off. There was like a couple, not all of it, but there was like a couple of technical questions, very technical questions. Now usually before my recaps for exams, I usually say what showed up and remember this and remember that. This one I can't really say explain the ish that's there, because I don't know if it's going to be graded on a technical level or is it going to be graded on, I don't know, like more like don't overthink. Because there's some questions where it came out where you had to think. Like there was one question where it showed up after administering glucagon, like what's your next move or something like that. A couple of questions came up, like the patient was supposed to be unconscious or something like that. Glucagon needed, what do you do next? Now the whole glucagon wasn't, it was emphasized but not emphasized on ATI level. If you're like in the nursing program and you're taking ATI, you know what I'm talking about. ATI are very technical. ATI are very detailed. ATI are very detailed on values, on actions, on critical thinking. That's what ATI really is. ATI is really there to mold your critical thinking at its form. And the way it does it, it breaks down the way you think, because congratulations, you played yourself. Welcome to nursing school, and whatever you thought was correct is wrong. So there was one question where it came out where it threw up some flags. We're like, whoa, this is a technical exam. Like, what is this? Like, there's one question that came out. Back to the thing, my bad, I'm sidetracking. For that one, like, what do you do next? Patient need glucagon, what do you do next? Yeah, like, thinking about it, there's like, I was like, and it was like one of those questions where it's like, yo, do you know it? Do you not know it? But if you don't know it, if it wasn't emphasized, can you critically think out of this situation right here? And I was like, damn, bro, are you serious right now? Like, facto? For real? Like, there's, the way it is that one, then afterward, there's one that says, like, you press on it for 5 minutes, like, because glucagon IM. And I was like, no, like, you're not gonna press on it for 5 minutes. Pressing on it for 5 minutes is long. That'll make no sense. That's completely out. So, like, nah, I'm not paying attention to that. Then there's one where you put a tongue depressor on the mouth, which is wrong. Don't make sense neither, because why would you do that? So I was like, boom. Then it was between two: elevate head or put them in recovery position. The word recovery position, like, that wasn't really emphasized in my lecture, and I was like, oh my gosh, what happened? And it was between elevate or recovery. Elevate or recovery. And that's where the technical aspect really kicks in. I mean, incredibly kicked in. Like, where it just kicked in, like, whoa, holy crap. Because, when you talk about this, elevate head, the first thing you'll say is, like, elevate head, airway. And recovery position for a minute, I was like, I can't recall what is a recovery position. Like, the only way I associated recovery position was when you're dealing with seizures. And that's when it kicked in, like, this is one of those technical questions. That I was like, I kind of got scared. That's the time when I was like, whoa, I need to read my exam incredibly more carefully, because this is a technical question. Because, like, I know if I read it somewhere and I know what a recovery position is, and, like, in those words, I would know it. But in ATI, I don't know if the current ATI, but usually they'll say the procedure and you turn them to the side and stuff like that, basically. Drooling or whatever, just in case of anything. So I was like, this is, elevate head don't make sense to me. And the technical question kicks in is, if you're on that point where you need glucagon IM, the situation's pretty bad. Like, the situations, and I think there were people, I forgot what it was, but people were telling me that it says unconscious. Well, unconscious, okay, then that totally makes sense why you put them to the side. Because if the patient's unconscious, or whatever, like super lethargy, the last thing when it comes down to hypoglycemia, which is why you're taking glucagon, is seizing. After you seize, you're at risk for comatose. That's the very last one where it's like you 100% neglected this, homie. So that's one reason why I selected the recovery. The recovery part was because of the fact that if it's in that point where they're going to start seizing, at least let it drain outward to the side. Like when you're seizing, the reason why you don't elevate it, because they could be pooling. If they're, or better yet, if it's not related to that, I was like, if the patient is unconscious, you don't elevate the head. Because if you elevate the head when the patient is unconscious, you don't even know, like, if saliva is pooling. And they're at risk for aspiration. So it was crazy. I was like, wow, this is. And before that question, I had another question where it come out of nowhere. They go, who needs further instruction, like further teaching and stuff? And boom, boom, boom. All the question was completely. Both of them was correct except for one word, and that one word was I will maybe something about it's a patient who has type 1 diabetes and who needs further instruction, and that was one where it says something insulin pill. And I was like, what is this a typo or is this a technical question? A typo would be, well, I actually meant hypoglycemic-ish. You get me? Technical-ish, there's no such thing as an insulin pill because insulin is a protein hormone. So if there is an insulin pill, you take that ish and it's going to be broken down in your GI system. So I was like, that's when legit I went back and started circling one or two. And there was actually one question where I overthink it. Like, I'm not gonna lie, like, I'll overthink that part. Where it says reassist because there was like a value really low. Then after it came down to the bottom where it goes, where they ask you what is your next action. Like, the person gave orange juice. 15 minutes later, what do you do next? And there's like a value, and I'll overassess that. It's actually supposed to be you give it another 15, and after 15, if I don't do nothing, you call the doctor. Technical question would be, that don't happen, the value was so low, you call the doctor, because you're not gonna try to give 15, another 15, the next, no, that ish don't change, or better yet, it drop, and that opportunity you could have done a glucagon. So if it was a technical question, it could be based on it's so low to the point you're just gonna call the doctor and just let the doctor know, and the doctor would be like, well, give another 15, or better yet, you know what, just administer the glucagon for emergency, because you don't want ish to go so low. When your ish goes so low, it's not good. Hyperglycemia is an ish where it's not a joke, just for the fact that the brain runs on glucose. The brain runs on glucose, and when you're a baby, it's developed through fat. That's how it is. So I was like, wait, is this a technical question? So I don't know if the question is really technical. Technical questions are all based on values, and that's all based on numbers, where it could be like, the number, like, yes, you do that, but the number is so low, you don't do that, because at this point, the patient is at risk for, like, coma or whatever, seizing, like, really bad stuff, like, incredibly bad stuff. So, I don't know what the answer for that is. Technically, in the textbook, it says you give another 15, then you resist later. So, I don't know. I don't know how I feel about this exam. I feel confident that I did pretty good. Like, I don't care if it's at 90. I don't care if it's 100. I don't care if it's 75. As long as I pass my G facto. But this exam was it was like a wake up. Like, oh, okay. We are on this level now. Oh, okay. It's very technical. Like, there's one, my bad, I'm talking a little bit too loud. Early morning time. There was one question where it popped out nowhere that what is one priority that you pay attention to? There's labs came in, what is a priority? And there's one now there's one where it was really off. The A1C was, I don't know, 9, right? 9. And A1C is 9, and then or something like that. And there's something, the A1C was really high because I was asking my classmate. I was like, I don't like comparing my answers with my classmate, but that just bothered me. Well, he asked me, not he didn't bother me. He asked me actually. He was like, yo, what you put in that one? Because that got me confused. I was like, I put the ketone. I said, well, that's what I put. What you put? I think he said something about I think he said something about the A1C or something like that. I was like, I put the ketone because the ketone is an emergency type of situation. It could develop into an emergency situation fast. Like, because the way I analyzed it, the way I analyzed the question on a technical level, the technical level is this will develop into a short-term development, like an instant-ish, which is DKA, which is diabetic ketoacidosis, where palmitoylate and this and that. Elevated A1C just tells you the person's not in control. Ketones in the urine tells you two things. Well, it could be three things. Well, now it shouldn't be saying three things, but the only time when it shows up is super hyperglycemia, where it's about to spill over to ketone, gestational diabetes, where you're still at risk for ketone, whatever, and starvation, but you're still at risk for ketone or whatever. So that's how I analyzed that question. I was like, I don't know, I thought it was important that ketone would be an important thing. I don't know what the answer is. I would think that would be important because if the patient has ketone, there's ketone buildup, and if the person is on ketone buildup, they're at risk for ketoacidosis, and if they're at risk for ketoacidosis, you know, things would happen, and like one primary thing would be the blood becomes like the patient's gonna become like hypokalemia. Yeah, kalemia. The patient becomes hyper K. The patient becomes hyper K, and when the patient becomes hyper K, they're at risk for dysrhythmia and stuff like that. That's how I analyze it. I don't know if that's how it is, but that's how I analyze it on a technical level, where the development would be that, and heart problem would be a bigger important versus you can't control your diabetes because according to the diet that showed up. I don't know, my G. I don't know. It's crazy. This exam was, I was just like, whoa, what is this? What is this? There was like, then from that point on, I started analyzing every question on a technical level, where I remember there was like, all that applies was what are classic signs with a newly diagnosed diabetes mellitus. And you have the poly, and there's one that says fatigue. And I was like, are you talking about hyperglycemia, or are you talking about hyperglycemia? Or are you talking about in general? Because an onset person, they'll experience fatigue. Like that's one thing that they'll start developing. They poly, and fatigue. And like sometimes they even like, for one, they even have weight loss and stuff like that. So I was like, wow, I don't know. Hopefully I did good. But that's what showed up in my exam. It was crazy. But I'm not going to review in details what, but like just things that you need to know is you need to know your values for the glucose-ish. You need to know your values. You need to know your DKA, the HHS. You need to know that. You need to know DKA is type 1, AAH is type 2. The prolong of AAH is DKA. If it's really prolonged, you need to know the signs and symptoms of the lows. You need to know the signs and symptoms for hypo. You need to know your drugs. Holy crap, my drugs. The drugs, yo, I'm not gonna lie. The drugs, it threw me off. I was like, whoa, hold up, my G. But now, well, so it's now or never. So, you need to know your drugs. Your hypoglycemia-ish. I don't know about maybe the other school, they'll be a little bit light on it, but the things that showed up was things that I was not familiar with. I was expecting things that I was familiar that showed up, but it was things that showed up that I was not familiar. I was like, whoa, usually in this category you use this, but okay, you wanna, that's what the technical, whoa, okay, you really need to know all of it. So that was my mistake. I based it on on past experience, but what will really show up is what's more popular, like in NCLEX. What shows up in NCLEX is mainly what are popular medications. You get me? The NCLEX is all based on the situation. What is the most popular, what is not the most popular. It's basic to assess if you're safe or not. Like the time when they had like the terrorist attack, a lot of the questions was emphasized on terrorist situation, biochemical stuff like that. When Spirita, or there's that medication where you inhale, it's for asthma and stuff, and that showed up. A lot of the questions will emphasize on that, so it all depends on the situation. I don't know, but one of my friends actually took the NCLEX, and she told me, she was like, yo, there was mad drugs. There was drugs. There was drugs. I don't know, but there was drugs. Know your farm. She gave me the heads up, like, know your farm. And I was like, oh, okay, nope, damn. But this exam, now, every exam is a learning lesson. What you made a mistake on it's an opportunity for you to grow from. And what I learned is, it's better safe than sorry. I'm not gonna lie, I went in comfort mode where I was just like, okay, this. It's not gonna get too technical. Now, yeah, things are going to get technical. Like this part, these are technical questions. This is where you really need to critical think. And I'm not gonna lie, especially that recovery-ish, if they said turn to the side and stuff like that, I would go for that automatically. But the only way it reminded me for the recovery was a part, this, that, unconscious, risk for hypoglycemia, seizing, and coma. And if you're seizing, you turn them to the side. And I was like, ding, it must be connected to seizing. You turn them to the side, recovery position, or when they're coming out of it. When you're coming out of it, it was, I don't want to say tough, but it was technical. It was definitely technical. People were saying that it wasn't technical, but it was, for me, I felt like it was pretty technical. I was just like, wow, okay. Oh, okay, it's game on mode. So basically, today I have to do my laundry. Get my scrubs ready, and legit, I am going to start working on my GI, because I have my GI, recovering GI, so now I'm just gonna get more heads up on that, because I'm not gonna lie, for the diabetes mellitus, I pushed that to the side-ish, because of the fact that we're doing endocrine, and I was emphasizing endocrine and pushing that to the side, and I was like, boom. So that is how my diabetes mellitus exam is. This is 19 minutes. I would edit this, but editing will take just way too much. My review, I'll probably do review-ish. That's when I really edit it. If you watch my video, you know how my review questions, my review videos are very chopped up and very straight to the point. So, and yeah, that, no lie too, I was doing that one, but doing that one too, it made me rotate, it made me understand hypo DKA AAH really well, because I was doing the editing nonstop, but that also took time from covering my medication, and I need to start really focusing, stressing out on the medication. I was stressing it out, but in more details with names, getting incredibly more familiar with it, but that's what it is. It is, my G. Facto, took the test, studied my hardest, did everything that I can. I watched the video, I did what I can. It's all in God's hands now. Facts. But best thing you could do is learn from the situation. I learned a couple of things, you know what I mean? So, I'm gonna end this little vlog, or, the diabetes mellitus update. So, therefore, please share it, and subscribe, and peace. Oh, and by the way, don't forget to subscribe, because, when I put up new videos, you guys will be notified. That's what subscribe is. And when you subscribe, YouTube will notify you. Be like, yo, boom, there's a new video that's out.
Wondering why it is I'm so cold. The only time I come around is when the snow falls, and I'm flying all the way across the map now. She's wondering when I'm coming back now. She's been waiting for me now.